All right. Wamsi is saying how to approach an acute case in pediatrics. When we are saying pediatrics cases, so I'll tell you, I'm MD pediatrics. I've done my MD in pediatrics. So I think I can answer this question, although I'm a teacher of Organon. I've been teaching Organon since last 20 years, but I did my MD in pediatrics. So how do we approach pediatric cases, especially acute cases? The biggest uh, part of pediatric case taking is observation. Observation when the patient is in your clinic, how the patient is behaving. That is primarily what decides pediatric case taking. Is the patient clinging to the mother? Is the patient clinging to the father? Is the patient comfortable getting down from the lap of the mother? Is the patient looking at you or not looking at you? When you are talking to the patient, is the patient looking towards you, or does this, or looks at mother and then answers, or doesn't answer at all? We have rubrics for all of these. We have rubrics for all this behavior. So you have to learn to convert this observation into rubrics, whether the patient allows you to touch or not. These are all observations, how the patient is friendly or not. Is the patient talking to you or not talking to you? Is the patient talking relevant or not? Is the patient, uh, even if it's a child, a 3-year child, they can talk a lot. Only if it's an infant less than 1 year old, then it's you primarily rely on your observation or the parents' observation. That is the second part. But for majority of time, if the child is above 2 years old, then they can communicate. Then you have to see how they are communicating. They are looking at you or not looking at you. They are avoiding the eye contact or making an eye contact. They are talking to you or not talking to you. They are clinging to their parents or hiding behind the parents. If, are they cranky? Are they very afraid of coming into your chamber? If how easily they get distracted, are they attracted towards something? If you offer them any candies or any toy, how do they react? All these things help us decide the primary nature of the child, and then we come to the mothers or the fathers or the parents observations and the way they tell the complaint. In acute cases, two things are important. One, what are the acute symptoms? What is the acute totality about the disease totality? You do not prescribe just on the basis of, okay, this patient is very irritable, so I give him Cinna. That is not how you prescribe. Cinna will only work in an irritable child if Cinna covers the symptoms of that particular child. Otherwise, Cinna will not work. So don't prescribe just on the basis of irritability. What you need to do is first figure out what is the disease, what are the symptoms that the patient has. If the patient has, say, diarrhea, then is your remedy, then first figure out what remedies cover that diarrhea. Is it watery diarrhea? Is the diarrhea mucoid? Is the diarrhea white, curdled? Is the diarrhea greenish? How frequent the diarrhea is? Is it offensive? It is sour? Is it purulent? What kind of diarrhea is it? What caused that diarrhea? First take all that, and then look at the mentals of the child. What has changed? Also remember, do not prescribe on the constitution of the child, that this child is very friendly in general. No, what has changed during the disease process? The change in the disposition is important. If it's a chronic case or an acute case, always look for the change in disposition. A child who is irritable in general but becomes mild during that diarrhea will not need Cinna. He'll probably need Calcarea carb or pulsatilla. It is the change in the disposition that is part of the disease. And a child who is very mild and timid in general, and then he becomes very irritable and cross, that child might need Antitart or Cinna or Scamomilla or something like that. So don't ask in general कि बच्चा कैसा है, बच्चे का नेचर कैसा है, वो भी पूछना है, लेकिन फिर ये भी पूछना है हमको पेरेंट्स से कि जब से बुखार हुआ है बच्चे को, या जब से इसको पेट में दर्द है, या जब से इसको डायरिया हो रखा है, तब से इसके नेचर में कोई चेंज दिख रहा है क्या आपको? क्या ये अभी भी बहुत ज्यादा रेस्टलेस है, या अभी ये डल है, अभी ये इरिटेबल हो गया है? क्या चेंज महसूस हो रहा है आपको इसके नेचर में? So वो जो change है वो important है. So always look for that change. So this is how you approach pediatric cases. First thing is doctor's own observation, very crucial, very crucial. What खांसी हो रही है बच्चे को, what is the child doing when he is coughing? Is the child doing like this, or is the child holding the tummy, or is the child just clinging to mom when he has cough, or is the child coming to you कि I have cough, चल मेरे को कांची हो रही है? Different remedies. So this is how you approach pediatric cases. And again, clinical examination is also important. Being a pediatrician, I can tell you that clinical examination is also important. 3 महीने का बच्चा आता है हमारे पास, वो थोड़ी बोलेगा कि ये पैर मोड़ के यूं कोलिक में उसको आराम आ रहा है या नहीं आ रहा है. नहीं, बच्चा तो नहीं बोलेगा 3 महीने का, 4 महीने का, 5 महीने का. That is where we actually take the child in our lap, and there are ways to that also. You need to learn it, and then we examine the child. छोटा बच्चा है, then we examine the child. उसका हम अगर पेट में कोई हमको लग रहा है बच्चा रो रहा है, तो हम उसका ईयर चेक करेंगे, हम उसका पेट चेक करेंगे, पेल्पेट करके देखेंगे, उसको हम परकस करके देखेंगे, उसका पैर मोड़ के देखेंगे कि उसको किसी तरह से तकलीफ बढ़ रही है, उसको आराम आ रहा है. क्योंकि बहुत सारी छोटी छोटी चीजें होती हैं जो पेरेंट्स भी कई बार नहीं ऑब्जर्व करते. So उसमें clinical examination का भी रोल है, and this was also written in Organon also, not specifically for pediatric cases, but in general also. Hahnemann has written in Organon that at the end of the case, when you have done all the case taking, the patient is spontaneously told everything, you have recorded your own observations, the attendant have told everything that they need to tell, and you still feel that you need to know more specific details about things, then you can actually ask the patient कि अब चल के दिखाओ कुछ होता है क्या फर्क, लेफ्ट करवट लेटो, राइट करवट लेटो, सीधे लेटो, उठो, बैठो, turn around, see, just to see if symptoms change, or if those actions are related to any modalities. So this is what is written in Organon, and that is what we do with pediatric cases. So again, very long topic, but this is how you begin.